Whether you need surgery for your torn ACL depends on a number of factors. These include your age, activity levels, what sporting activities you currently do, and also how stable your knee is. Usually, we'd like people to have tried a course of physiotherapy, and then if that doesn't help, then proceed with surgery. There are a number of grafts that can be carried out for an ACL reconstruction. These include hamstring graft, patella tendon graft, or a quadricep graft. I like to use a hamstring graft, and I tend to use the patella and quadricep grafts for revision or redo cases. Sometimes patients have an individual preference, and I'm more than happy to discuss with them the pros and cons of each graft type with them. ACL reconstruction is quite painful. I use keyhole techniques to help you get home on the same day. I expect your wound to have healed fully by about 2 weeks, and for you then to be starting your physiotherapy protocol religiously. I'm looking at 3 months for you to start running on the spot, at 6 months to start running and twisting, and even taking part in some non-contact sports such as tennis. And at 9 months, that's when I'd like to see you getting back to playing contact sports such as football and rugby. With any type of surgery, there are risks. Unfortunately, for ACL reconstruction, these are small, although you need to be aware of them. One of the biggest ones that we're worried about, and that you should be worried about, is the risk of re-rupture to your graft. And there are a number of ways you can help to prevent this. The other risks are stiffness, a patch of numbness to the side of your scar, blood clots, but we take measures in order to reduce the risks of these happening. One of the most important things for you to do as a patient after your ACL reconstruction is to adhere to your physiotherapy protocol religiously. With that, I expect you to be doing your exercises every day, just like brushing your teeth. And also, what I need you to be able to do is to not go back to your usual sporting activities too soon, because that's one of the biggest risk factors of getting a re-rupture to your ACL. Other things that you can do is, if you are a smoker, to cut down, if at all possible, to stop completely, because that will help with the healing process. And also not to do anything silly and just use common sense.